All right, ventricular rhythms. So ventricular rhythms are really important because that's where our lethal rhythms fall. So the first one is V-Tach, ventricular tachycardia. And remember we talked about ventricular rhythms are wide. So our ventricular rhythms are going to have a QRS greater than 0.12. All right. And V-Tach can have either a pulse or no pulse. So we have to remember that you have to always check the pulse when a patient is having V-Tach. And V-Tach, it usually looks very uniform. Okay, and that's what it looks like. And we're going to have a rate of 100 to 200 beats per minute. Okay. Now, if you have a pulse, so with a pulse, then we are going to cardiovert. The only way to fix V-Tach is to shock the patient. You have to shock the patient to get them out of their ventricular rhythm. So if they have a pulse, you want to cardiovert because that means that though their rhythm is lethal, they're still generating a pulse. So you want the machine to work with them, not against them. Okay? So with cardioversion, then when you're going to hit the sync button, and when you do that, you're going to see the little marks on the QRSs, and that tells you the machine sees the patient's rhythm. And once you hit shock, there's going to be a delay. The machine will wait until the patient's beat is finished, and then it will shock. Okay? If you have V-Tach without a pulse, okay, no pulse, number one is CPR. You have to do chest compressions. 4 minutes and your brain no longer has oxygen, okay, and then you start having brain death, or cells dying in your brain. So you have to do CPR until someone can get a defibrillator, because the only way to fix V-Tach is to shock. So you can do CPR all day long, but until you have something to shock the patient, you will not get a normal rhythm or any other kind of rhythm that is good, okay? So CPR, and then you want to defibrillate, asynchronous, so you're going to charge, shock, bam, and then you're going to continue CPR, okay? The drug that we generally use in V-Tach is epinephrine, 1 milligram every 3 minutes. So someone should be responsible for calling out when it's been 3 minutes, and we give the epinephrine in a cycle every 3 minutes. There is an Acls algorithm that you're going to follow, but just in general, when you have V-Tach, check for a pulse. There's no pulse, you start CPR, call for help. You get a defibrillator, you shock the patient. You shock and do CPR for a couple of cycles, and then you do the epinephrine every 3 minutes. And then you think about an airway. Most of these people will have an endotracheal tube and go to the ICU. And the next drug that you would use would be amiodarone. Amiodarone is generally used for ventricular type rhythms, and it kind of took the place of lidocaine, although lidocaine is a very good drug. It's just an older drug. So this is kind of the gist of what you would do with V-Tach. Okay, but it is a lethal rhythm, and if you don't treat it, then you will die. And then the last ventricular rhythm is ventricular fibrillation, VFib. And much like AFib, where the atria are like the jello on the plate, now the whole heart is just like this, just quivering. So there's no output, there's no pumping of blood. And VFib is generally like this. And sometimes it goes up and down a little, but it's very fine, it's very small usually. And they will not have a pulse. So if they don't have a pulse or you're not sure if you feel a pulse, then that's not a good enough pulse to perfuse, so you're going to do CPR. The drug that we would use is epinephrine, and you have to shock the patient. It is a shockable rhythm. You have to shock them or you can't fix it. Okay? And then the last lethal rhythm that's very important is asystole or flatline. Now, it's not like in the movies where it is a straight line, okay? It's generally like this because remember you're reading it through the patient's chest and the patient may be breathing on the machine. There is usually a little bit of something electrical that we pick up, but it just looks like this, okay? And that's asystole. It is not a shockable rhythm. No shock. Okay? But we do CPR, and we also give epinephrine. Asystole is more about the cause. Okay, what caused it? Is there something we can do to fix it? Patient really acidotic, high potassium, stuff like that. Okay. We also have PEA, which can be any kind of rhythm. Pulseless electrical activity. So you could have this, and you go in the room and your patient's unresponsive and they have no pulse. So PEA is basically, they have something on the monitor and they have no pulse. And this is all about treating the cause. We do CPR and we treat the cause. Okay? If they have V-Tach or V-Fib, we shock it. If they have very low bradycardia, we could pace it. So we still treat whatever the rhythm is, but because they have no pulse, we're going to do CPR and then look and see, can we figure out why they're in PEA, and is there something that we can do to treat that? Okay? Thank you much.